So one of the things I'm most excited about is that we now have iodinated spacers. It's called SpaceOAR Vue. So why do I like an iodinated spacer? So when we're treating with SBRT, the first step is putting gold markers in the prostate with the SpaceOAR. The second step is getting a treatment planning MRI and a treatment planning CT scan, fusing them together, and then I take those scans and I tell the computer to hit the prostate without overdosing the rectum, the bladder, and the penis. So you have a treatment planning MRI. It's really easy to see the differences between the SpaceOAR, the rectum, the bladder, but not all patients can get treatment planning MRIs. What's happening is many patients are now getting pacemakers or other devices that are not MRI compatible. Then I'm in a situation where I can get the treatment planning CT scan, but I can't get the treatment planning MRI. And let me tell you, the MRI is very useful at telling me the difference between where the prostate begins and where the rectum begins. Contouring without an MRI becomes very challenging to say where the prostate is and where the rectum is. Whenever it's challenging, you're more prone to making mistakes in either underdosing the prostate or overdosing the rectum. When I have the iodinated spacer between the prostate and the rectum, it makes it really easy for me to delineate the rectum, delineate the spacer, and delineate the prostate. And why is that important is if you don't delineate correctly, you can't dose correctly. The person in my department who loves the SpaceOAR Vue the best is actually my dosimetrist because it makes her job much easier. If I over contour things, then it's more challenging for her to spare the rectum. So when we have an iodinated spacer in place, I contour the prostate very accurately. I contour the rectum very accurately. The treatment planning process is much easier because it's much easier to spare the rectum and limit the dose to the rectum. So she spends less time on each plan. Dosimetrists are very important. They're very busy. I don't want to be wasting their time. Having the iodinated spacer saves me time when I'm contouring, but it also saves my dosimetrist time when she's doing the treatment planning, so that we can actually more effectively treat more patients more quickly. In my opinion, SpaceOAR Vue should be used on every patient. The iodination is very helpful in doing the treatment planning, even when you do have an MRI. The iodinated spacer does not look different on the MRI than the non-iodinated spacer. So it's very helpful in the treatment planning. I've been really happy with the SpaceOAR Vue. I think every patient should be getting it. Every once in a while we have a patient with an iodine contrast allergy, and I commonly don't use it in those patients, but that's really the only reason I wouldn't use it.